The hip is one of the most common locations to have osteoarthritis. It's a very common condition suffered by military veterans. In this video, I discuss hip arthritis, the signs and symptoms, and how injuries in the military can lead to hip arthritis. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Now, arthritis is the wear of the articular cartilage, the lining on the ends of the bone, and the bone under that worn out cartilage was called the subchondral bone. In the case of the hip, it's at the hip or at the ball and socket part of the hip. Typically, the symptoms are felt in the groin rather than on the side of the hip or the buttock, and it typically limits motion. Obviously, as it gets worse, it starts to limit walking, running, physical activities like that. A lot of times it comes on over a long period of time, whether it's a traumatic event or repetitive activities that you've just been doing for a long period of time. And it's a very significant cause of sort of negatively affecting the quality of life. It affects millions of people, and there's millions of hip replacements done across the world every year. Now, studies have been done to look at why hip osteoarthritis develops, and there's a number of thoughts. Suboptimal mechanical loading, whether that's an abnormal gait pattern from an injury when you were younger, some sort of degenerative condition of another joint in the, say, the lower extremity like the knee or the spine that may put more stress on the hip, that can all play a role in hip osteoarthritis. Hip loads affect the biology and structure of that articular cartilage lining in the ball and socket part of the joint and can contribute to the osteoarthritis. People with hip osteoarthritis, as I said before, typically have pain with weight bearing, but sometimes it can even be pain at rest when you're lying down, sitting in a chair, things like that. It leads to altered muscle forces and altered movement patterns during any activities you do throughout the day. Walking, climbing up and down the stairs, and things like that, and can lead to a long-standing problem. What I see so often with hip osteoarthritis is whether it was a traumatic injury to the hip when they were younger, an awkward fall, an awkward jump after jumping out of a vehicle, or paratroopers parachuting and bad landings, either single or a couple of events in the military, or it's just very demanding activities, whether it's ruck marches with huge amounts of weight, whether it's running every day for 6 or 10 or 12 miles or whatever it is, carrying everything that they need to be able to do for their duties in the military, that leads to wear and tear of that joint over time. And again, very often too, you see it secondary to, say, knee arthritis or lower back degenerative conditions or injuries. So there's secondary hip arthritis as well. But I see this very, very often in military veterans that reach out to me. If you have ideas for topics for this channel and videos for this channel, whether it's risk factors for injuries, the injuries themselves, particulars about DBQs or Nexus letters, whatever it is, leave those in the comments below. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you yourself are interested in a Nexus letter for your injury or condition, click the link in the description below and you can learn more about working with me and working with my team. We try to make the process simple, we try to make it quick, and I really do try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you much more.